Before we dive into the different classes of antidepressants, let's start with what all antidepressants have in common. First is that none of these medications work overnight. Antidepressants usually take several weeks before the clients feel their full effect. This means that one of the biggest teaching points is encouraging clients to continue taking these medications consistently, even if they don't notice immediate benefit. Now, here's a critical NCLEX safety point. All antidepressants can actually increase the risk for suicide, especially in children and adolescents. And that is why close monitoring, especially during those first few weeks of treatment, is so important. We also need to be on the lookout for serotonin syndrome, and this is a potentially life-threatening complication that happens when serotonin receptors get overstimulated. And this is most likely to occur in clients who are taking multiple serotonergic medications like SSRIs, SNRIs, MAOIs, supplements like St. John's wort, and even triptan medications that we use for migraines. Now, the easiest way to recognize serotonin syndrome is to remember your 3 S's. The first S is for sweating or fever, which are signs of autonomic dysregulation. So we might also see symptoms like high heart rate and high blood pressure. Our second S is for shaking. So we might see things like tremors, hyperreflexia, or muscle rigidity. And our third S is for strange behavior. And this refers to the mental status changes we might see with serotonin syndrome, like agitation, confusion, or even hallucinations. So if you see an NCLEX question where a client on an antidepressant suddenly develops tremors or muscle rigidity, fever, and agitation, I want you to think serotonin syndrome and recognize this as a medical emergency. So you need to hold their medication and contact the healthcare provider right away. And finally, we don't want to combine any antidepressant with St. John's wort. This is an herbal supplement because, as we just talked about, St. John's wort is serotonergic and it will significantly increase the risk for serotonin syndrome. Now let's take a closer look at the specific considerations we need to know for each of the antidepressant classes.